Let's talk about OASIS Item GG0130 because this is one of those items that looks clinical on the surface, but it has real financial and performance implications for home health agencies.
GG0130 lives in section GG of the OASIS assessment, and it measures a patient's ability to perform self-care activities at the start of care. This includes things like eating, oral hygiene, toileting hygiene, showering or bathing, dressing the upper and lower body, putting on and taking off footwear. For each of these, a clinician is scoring how much assistance the patient truly needs using a standardized scale, from independent to fully dependent. Now here's where GG0130 becomes more than just a clinical checkbox. First, GG0130 directly influences PDGM payment. The scores from GG0130 are combined with mobility scores to determine the patient's functional impairment level, which are low, medium, or high. That functional level is part of the PDGM case mix calculation, which means it affects how much Medicare pays for that 30-day period. So if a patient is scored as more impaired, the agency is paid at a higher rate because Medicare recognizes that the patient requires more resources. But there's risk on both sides. Undercoding GG0130 can lead to lost legitimate reimbursement. Overcoding creates audit and compliance exposure. Accuracy is what protects revenue. Second, GG0130 affects your home health value-based purchase performance scores. Medicare looks at functional improvement over time, specifically how much a patient improves in self-care from start of care to discharge. If GG0130 is scored inaccurately at start of care, the patient may start too high, leaving no room to show improvement, or start too low, raising red flags later. Either way, inaccurate scoring can hurt your value-based purchasing outcomes, which puts future reimbursement at risk through penalties or missed incentives. Third, GG0130 is a high-risk audit item because it's based on clinical judgment, but it must align with visit documentation, therapy evaluations, care plans, and functional observations across the episode. When those don't line up, it becomes an easy target during ADRs and UPIC reviews.
So here's the bottom line. GG0130 influences today's payment, tomorrow's reimbursement adjustments, and your overall compliance risk. It's not just a nursing or therapy responsibility, it's a revenue integrity issue. Agencies that train clinicians to score GG0130 accurately and defensibly protect PDGM revenue, home health value-based purchasing performance, and audit outcomes. And agencies that don't often feel the impact months later when it's much harder to fix.